My name is Dr. Islam, Fakhrul Islam. So I graduated from Pakistan and I came to this country in 2004, and since then I've been working in the National Health Service in different specialities, and I've become a consultant in 2013, and since then I've been working as a consultant here. So the working here, medicine is not different from medicine anywhere in the world, but there are cultural differences, which is a part of our primary education. We have to adjust ourselves to the people that we are treating. We need to understand their social values and their cultural values, and then we have to take into consideration that as well. But otherwise, medicine remains the same. The good thing about practicing in United Kingdom is working in the NHS, that you have got set protocols and guidelines to follow, and when you are following these guidelines, the life becomes easier, and it becomes very easy to make your patients understand their conditions as well. So I think there are a lot of positives as well, but the medicine itself, it remains the same. It's not very different from what we have learned back home in our medical schools. So after passing my plab, when we were doing our plab back in 2002 and 2003, so you have to go through your International English Language Testing System, IELTS. So we did our IELTS, then it was the plab 1, which I did in Pakistan, and then for plab 2 we came to UK. So I passed my plab in December 2003. After getting a plab, at that time we used to have something called the honorary contract. So if we are already working in the hospital as a clinical attachment, you can get the honorary contract, based upon which the GMC would give you a limited registration. So once we got the limited registration, we can go and work, and after a year of satisfactory performance, our supervisor, they would recommend us for the full registration. So we got our full registration after a year. Since then, I've been working in NHS. There was a year of medicine, 1 year in internal medicine, followed by emergency medicine. Emergency medicine is there is a set training for 6 years, and at the end of 6 years you become a consultant here. So I finished my training in 2013. There are 2 different exams. There used to be 2 different exams, membership and the fellowship exam. They have abolished the membership exam. I think it was last year when there was the last membership exam for the emergency medicine. So now there is a fellowship exam, but it has got all the components of the membership and the fellowship exam. So yeah, that's about it. It looks daunting from the start when you're starting as a fresh graduate, but actually it's one step at a time. So if you take one step at a time, you will progress, and if you are determined, you're honest, you will get there. Okay, so the challenges are there. There are different challenges in different specialities. There are something, I think the first thing is the cultural challenge. Although we are taught in English language, but when you come in here and you work in especially different regions of UK as well, so there's London, there is North, there's Midland, so different regions, they have got different accent as well. So to understand the way people speak and the way people use day-to-day proverbs and their day-to-day language, this is something that you have to get accustomed to when you come in first and start working here. So there is something initially, when you go past that barrier, it becomes easy to develop that rapport with the patient. That is very, very important when you are dealing with a patient with an illness, to understand actually what their problem is. So this is the first thing. Another thing that I want to say about for those people who are coming in here, leaving the family behind, I think this is the biggest challenge that you are going to face if you are leaving, because we come from a background where there is an integrated family structure. So when we leave that family, it is psychologically very daunting for us as well. When I came to this country, I was already married and I had a 2.5-year-old son that I left behind, and I was here for 6 months doing my plab 2, trying to get the attachment, then going for my honorary contract, and then working through that honorary contract, getting the job. So that 6-7 months period, that is challenging, but this is something that will pay you off when you get into the training. Getting into the training it depends upon what specialty you want to work. So there are some specialties which are more competitive as compared to other specialties. There is a national shortage, I would say, about the GP specialty. There are a lot of opportunities in the general practice. There are a lot of opportunities in the emergency medicine, in acute medicine, and then going on from the acute medicine, different subspecialties of emergency medicine, subspecialties of medicine like gastroenterology and cardiology and endocrinology. But there are, if you come and you see yourself, there are training doctors from India, from Pakistan, from Nigeria, from different parts of the world. They are coming in here. They are working as a training doctors. In our trust, the majority of the consultants working here were not graduated from UK. So they are graduates from outside the UK who are a consultant here. That is the majority of it, and this is same in up and down the country, different hospitals. So it is challenging to go through your first step, then go into your specialities, and then getting your entry exams, and then getting your exit exams. But it's not impossible. I would say it is probably as competitive as in our own countries. We have got in Pakistan, for example, there is a fellowship exam for the College of Physicians and Surgeons, and it is a challenging exam. People who have done that, they would say that it is challenging. So there are similar kind of challenges here, but there is no obstruction to, because you are an international graduate, to your progress. You can progress as any other person. There are some initial glitches about when to apply for the training post, but hopefully that will be sorted out in the near future as well. So if somebody who is looking forward to come to UK to get their training, to progress into their career, into their chosen specialties, I would strongly recommend that. And there are a lot of people here who are here to help. Okay, so when I came to UK, I was the emergency medicine was not a specialty in Pakistan, so I wanted to be a physician here. So that's why I started my job in medicine, in internal medicine. I started with acute medicine, so I did a year of acute medicine, and at that time the job market, the training jobs were very, very competitive. So I was not able to progress into medicine, so I switched by accident to emergency medicine. So when I came to emergency medicine, after a year of emergency medicine, the things opened up. There are a lot of specialities which were available. There was general practice, there was internal medicine, and the other specialities as well. But I chose to stay in emergency medicine because I started liking it. There are a lot of challenges in emergency medicine, that you have to see unfiltered patient coming into the front door of the hospital. That can be a 1-day-old child, a baby, a neonate, to 90 years old, 100 years old, and you have to see everything in between, all the specialities, unfiltered patients. But I think this is the fun part about the emergency medicine, that you don't know what is coming next, and you are ready for the next challenge. There is no boredom in emergency medicine. You have got a lot of fun. You see a lot of acute medical patients, and you get that satisfaction when somebody is coming in who is in acute respiratory distress, and you start treating them, and when you see them getting better before your eyes. so you feel better. Similarly, somebody coming in a lot of pain, simple thing as a pain, and you prescribe them good painkillers, then they become comfortable, so you get that satisfaction from inside. Emergency medicine, as I said, that there are a lot of opportunities. The challenges are there. The work is hard, but your time goes very quickly while you are working on the floor, and you are always looking to see some new things, and you are always learning when you are in emergency medicine. So yeah, I'm all for emergency medicine. Please do come in and join emergency medicine in UK. So my favorite things in UK is in terms of working life and in terms of practicing medicine, that you can practice whatever you want to do. I think this is something, when we started working back home, there are a lot of challenges depending upon where you are working back home, and you are not able to do things for the patient that you could do in a developed system. So over here, whatever you want to do, you can possibly do for the patients. Obviously there is a limitation to what you can do, but at least you have got the resources available to do with the patient. Outside the work, the summers are beautiful here when you have got really long days. So when you come to work, it's already bright and sunny, and when you go back home, it's still bright and sunny. Obviously that has got a downside when the fasting is in summer, but after that it's pretty much okay. Now, one thing people have got a misconception about the weather in UK is that it's very, very cold. It's not very, very cold. It's oceanic climate, which means that we get, because of the Gulf Stream that we get from the west, we have got a really mild winters as compared to rest of the Europe, what we call as the continental weather. So we don't we used to get snow every year, but now it's not necessarily snow every year, and even when we get the snow for a few days, it makes the whole environment beautiful. You have got the people who are looking forward to take part in sports. There are a lot of opportunities, especially from people from India, Pakistan, Bangladesh. They are coming in here and they are quite keen on playing sports. We have got our cricket, sorry. We have got our colleagues who are playing like on a league level. They play cricket during summers. If you want to play any other sports, there are opportunities for you to take part. Badminton, table tennis, squash. There are gyms everywhere now as well, so there are a lot of extra things that you can do. If you want to enjoy the photography, there's a lot of opportunities for that as well. There are other things that you can do outside the work, and there are plenty of opportunities. So advice for you is, if you are looking forward to come to UK and work as a junior doctor and then get a training job, the first advice is do it, please, and take the first step, whatever it is for you. If it's the English language testing exam, take that. If it's a plab, you must go for that. Once you are here, try not to limit yourself geographically. There are some people who come in and they say that they want to stay in London or they want to stay in the big cities. The big cities like Birmingham, London, Manchester, they are there. Sometimes it becomes difficult to get into those bigger hospitals, bigger specialities. So do not limit yourself geographically initially. Do not limit yourself geographically to the specialities that you can get into. So if you can get into emergency medicine or acute medicine to start with, take that opportunity and then start looking for the specialty of your choice. Because you haven't worked in that particular specialty, you should not rule it out from your list. That's my advice that I always give to the trainees who are coming to emergency medicine. So this is something. And the other thing is, when you are coming in here, be if you're a hard-working person, stick to your basic ethos that you are working with. Be honest, be hardworking, and the opportunities are here for you, and there is nothing that can stop you.